Systemic barriers to health and dignity are the root cause of suffering across the continent.
Our work at Society for Family Health is actually beyond providing health care. It is not just providing health services. In my heart and in my mind, it is providing dignity. The fact that we are reaching millions of people with clean water, with hygiene products, with disease prevention products, with hundreds of health facilities, training health workers, to me it is actually living my promise.
Dignity begins with access. Health cannot be a luxury. But what is a right if you cannot reach it? That is the question we answer every day. For the 57% of Africa's population in rural areas, this is the reality of health inequity.
Ntabwo dutegereza, turubaka, ntabwo twubaka gusa, ahubwo dufite isezerano ku baturage bose, kubavura tukabasubiza agaciro kabo.
A building is empty without people. The WHO warns of a 10 million health worker shortage. But we see Africa's youth, 60% of the population, as the single greatest asset to solve this crisis.
Ntabwo ndi umuforomokazi gusa, ndi rwiyemezamirimo, ndi umuyobozi, SFH ntabwo yampaye akazi gusa. Yanyongereye ubumenyi, yagura inzira y'umwuga wanjye.
In the pipeline, we have Africa Healthcare Workers Academy, a gateway for talented and skilled healthcare workers that are really going to transform this continent with young people with the right skills, with the right tools, with the right mindset to be able to shape the whole of Africa's healthcare. In fact, we strongly believe that we are building a generation of healthcare leaders from the ground up that is going to transform this continent. Imagine a health system whereby over 90% of its health supplies and medicines are imported. Basically, you have no control. So, this is not only a supply chain problem. Actually, it is far beyond. It is complete breakdown of healthcare. It is a broken system, and this can be fixed. So what we are doing with our partners, what we are advocating for, is actually having local production of medicines, having the capacity. I strongly believe that if we put our minds together, we can have the medicines we need in-house or in the country.
Hope should not be imported. Our model is different. We use social marketing to create demand and build trust in affordable and quality-assured products. Then we empower local entrepreneurs to build decentralized, community-owned supply chains to deliver them.
Okay.
We launched our Blue Room, connecting to our health post to a centralized data hub powered by EMR system, artificial intelligence, and satellite connectivity. We are moving from reactive storytelling to predictive, population-level health strategy. This is where cutting-edge technology meets the fertile ground of community needs.
Dignified healthcare should be affordable. Over 100 million people are forced into poverty every single year because of lack of capacity to pay. That's why at Society for Family Health, we have been lucky to partner with institutions like Rwanda Social Security Board, RSSB, Rwanda Medical Supply, with the support of the Ministry of Health, under the guidance of the government of Rwanda, to make sure that all our facilities that are run by nurse entrepreneurs are able to have their expenses reimbursed. It is no longer that healthcare is an expense sector. Now it is actually an economic engine, especially in the rural areas. So I believe this model and many others combined can break the chain of the issues related to health financing. Providing health care should not be looked at as a charity work. It is actually a strong business case, especially using blended financing and nurse-led entrepreneurship model. We have now over 300 clinics that are run as businesses. They have over 5 million customers, and they're making money and providing health services to people. So we have seen significant improvement in health outcomes and lots of employment. So many people are employed and lots of revenues being generated. At SFH, we do not only provide health services, we build leaders across all the levels. Leaders at the national level who help in the shaping of policy and really providing the input for policy formulation. We also build leaders at community level, like nurse entrepreneurs, community health workers, who really shape the actions, who coordinate, and who build systems that are trusted by the communities themselves. And there is strong accountability mechanism that is embedded and inbuilt, such that the health services that are provided, you can be able to assess and see the quality. You can be able to provide timely feedback, which is acted upon to make improvements. And these systems help us to make sure that they keep us on track, and we are able to replicate them to other communities. So really the concept of leadership and governance and accountability are core at our heart and at SFH's interventions.